Hey friends, it's Peggy Hall back with you from thehealthyamerican.org. I've got a question for you about your medical care. I want to know if you have discovered that your doctor is hiding something from you. Now, I personally don't really go to doctors, and I certainly don't go to the mainstream medical merry-go-round doctors. I do have my own doctor, Charie, and I've brought her on the show before. She is an MD, but she's an integrative medical doctor focusing on functional medicine and much more of a holistic approach. And I luckily do not have anything wrong with me, but she is someone that I can go to if I have questions. So I have this very interesting situation that I want to share with you anonymously from a healthy American who wrote to me today about this very startling discovery that she made at her doctor's office. And I can't speak for myself because, again, I have not been in a doctor's office for many years, but I wanted to alert you to this in case it's something that is happening to you as well. And then I do want to share with you, after I bring you a message from the sponsor, what I do for my own health insurance, because I don't have traditional health insurance. I have something else, which is a Christian health share ministry. And I want to tell you how that operates and a condition that a couple of procedures that I had to have several years ago and how that all turned out for me. And then I also, if I can remember, I want to share with you a couple of your cards and letters that you've been writing to me. And there was one that came in again related to healthcare. And I want to answer that question as well. All right. So before we get underway, let's do this. I want to give you a message from the sponsor of the video. So I'm going to share my screen here and we are going to hop right on over to thehealthyfat.com/Peggy. And the message I have, and this is a free video for you to watch when you go to thehealthyfat.com/Peggy. It turns out that the key to losing weight and keeping it off is not in carbs or fat or even in probiotic rich foods. Nope. The end game of having a healthy weight, as well as more energy, and a long, healthy life comes down to a specific switch that you flip in your body to flush out unnecessary calories. And Dr. Stephen Gundry, that you see right here, calls this a caloric bypass. So by activating this specific process in your body, Dr. Gundry has seen thousands, yes, thousands of people dramatically improve their health, even at age 50 and beyond. This includes losing weight, getting tons of more energy, and returning to the good health that you had in your youth, simply by addressing this one key to better health. And not only that, but this is actually associated with improved digestion, strong feeling joints and muscles, smoother skin, and healthier, I should say, lives, probably healthier, because that could be the key to a happier life. So Dr. Stephen Gundry himself has lost 70 pounds himself by using this research. He has kept the weight off for over 20 years and counting. His digestive issues are gone. His health is fantastic, and he feels younger and healthier today than he did in his 40s. This video here at thehealthyfat.com/Peggy has been watched by over 20 million people to date, and you can watch it as well. I will also have it linked for you in the bottom of this video, and he is going to teach you exactly how he has kept his weight off, and you can get that information for free at thehealthyfat.com/Peggy. Speaking of staying healthy, I would like to know your tips and tricks. And one of the things that I do is I just don't go to the doctor. All right. I really never have gone that much, partly because I was raised, my mom was an RN. She was in the emergency room, so she was more involved in trauma medicine. She was not a person that believed in a lifelong regimen of prescription drugs. And she actually ironically, and probably if you're a nurse or you know any nurses, you'll know that they are a little bit skeptical about the doctors that they work with. So anyhow, just putting that on the table, I wanted to let you know about this very bizarre situation that a healthy American alerted me to about this information that her doctor is hiding from her. And I found it so stunning. I'm going to keep this absolutely confidential, but I need to know if this has happened to you. And then stay tuned, because I also want to tell you about my own health care that I do, which is not a part of the mainstream medical merry-go-round health insurance. I don't participate in that at all. I have something else that has worked for me great, and I want to share that with you along with some of your cards and letters. So the email that came into me today said, Peggy, I visited my doctor, and it was a new doctor because my other doctor moved from California to Florida, which I think a lot of California doctors did move because of the restrictions and all of the censorship and other oppressive tactics that are going on in California. And she said, so I had a new doctor, a young woman who was a PA, a physician's assistant. And my Healthy American friend said that she went in with a bag of supplements that she wanted to ask this medical professional about to see whether or not she should be taking them and if they were working well and so forth. And the woman, the doctor, the PA, was on her computer and asked her a few questions. And then she suddenly said, I need to leave the room briefly. And she took her computer and left the room and was gone for about 20 minutes. Now, that's kind of strange in and of itself. And I find that very unprofessional for a doctor or any medical professional to just leave you hanging for about 20 minutes. And my Healthy American friend, after the 20 minutes, actually went out to the nurse's station to find out where this physician's assistant went, and they couldn't find the person. And so she herself went back to the waiting room. And as she did that, she noticed a piece of paper that this medical practitioner had left on the counter. And it had the Healthy American friend there. It had her name on it. And she took a look at it, and it had a list of 5 chronic diseases that my friend doesn't have and never claimed to have had. And it's listed with the chronic disease, the date of the diagnosis, and then apparently whatever the protocol is that the person is supposed to do. She was shocked, number one, that she had been diagnosed with these chronic conditions that no previous doctor and this new one had mentioned to her. And the second thing is she doesn't have these conditions and she doesn't have the associated symptoms. So she had in her mind this question of what is going on? Is the medical center charging Medicare or Medicaid or her own insurance for these conditions, for these treatments or drugs or whatever is associated with these chronic conditions? And one of the chronic conditions, and I am not a medical professional, I'm not giving medical advice, but it's something that has always struck me as a little strange. And now perhaps if you have studied this, you're going to set me straight. But one of these conditions was pre-diabetes. Now, I don't know about you, but anytime I hear that word pre, it's like, well, it doesn't exist yet. So you're going to have a pre-engagement party. You're not engaged. It is not a situation or circumstances that exist. So if someone is pre-diabetic, for example, I would like to know, and maybe there are some there's some way of testing or measuring this, but what exactly does that mean? Doesn't that mean that anyone who is not diabetic is actually pre-diabetic because they are not diabetic? So I find that concept of pre very unusual, to say the least. And of course, let me give my disclaimer that every single thing that the CDC and the WHO say about your health is true. And so we are not to question it, and I'm not questioning it, and I'm certainly not questioning the existence of pre-diabetes. And if you have that, I hope that you are getting the attention and the care that you need. All right, got that out of the way. Now, my friend was so taken aback at this list of all of these pre-conditions and chronic conditions that she never has complained about or claimed to have had. And she wasn't able to speak to this medical professional who never came back to the room. And by the way, my friend had to leave to go to another appointment. So she left with, I think, with this paper in hand. And her question for me was whether or not I had heard of something like that, and whether or not her having access to that information confidentially was going to cause any problems. And of course, I don't have any answers for that. I would imagine that your medical history should be shared with you from your medical professional, with and by your medical professional. So I find that very strange. Now, in the old days, like a long time ago, I remember going to the doctor, I had I can't even remember exactly why I went. And the doctor said, did you get your flu cocktail? And I'm like, oh, well, for YouTube's sake, I'll say yes. And of course, that didn't sit very well with the doctor when I gave her my real answer. And again, that every time I would get like notices in the mail to come get the free cocktail. And it's like, why are they pushing this so strongly? And I know what happened is I had to undergo an EKG to determine whether or not I was healthy enough to undergo general anesthesia for an eye procedure that I had to have to replace, no, not really replace, but to fix and repair a detached retina. And that's going to bring me full circle to talking about my lack of health insurance. I do not have traditional health insurance. I stopped having it back in 2008 when the Unaffordable Care Act came into existence. And possibly that has helped you. And if it has, fantastic. There have been millions of people that it has harmed because of the changes that happened in medical insurance. It's amazing for me to even admit this, but I had Kaiser health insurance for many, many years. When I worked at the university, that was one of the offerings that they had. And I was actually very pleased with the level of care that I had. I had to get some eyeglasses, and I had a trigger finger that I had repaired. And this is many, many years ago. And at that time, I think the copay, it was like $25 to see a doctor. There was no deductible. And then my employer paid for this and for my family. So my level of health insurance, money was very, very low. Later, when I left the university, I was able to keep the Kaiser health insurance, and I paid for it on my own. And I think it was like $350 with a $25 copay for every visit that I had. And I had very few visits because I'm very healthy and I don't like to go to the doctor. But after that Unaffordable Care Act came into existence, that $359, monthly payment for my health insurance went to about $1,200 per month. And there was a $5,000 deductible, meaning I had to spend $5,000 out of my pocket before the health insurance would even kick in. And that $25 copay for a doctor's visit, I think, shot up to $75. And I'm looking at this going, first of all, I don't have the $1,200 that I want to spend on health insurance. And I remember for a period of time, I did not have health insurance. I broke my foot and I paid to go to the doctor out of pocket, and they x-rayed my foot. They diagnosed everything. They actually even put me in a boot, and all of that, including the x-rays and the doctor's visit. Guess how much? Okay, this was back in 2014. And that was $50 in Southern California, which is arguably one of the most expensive places to get your health care. And I was so grateful that the doctor gave me that fee. And I let them know in the beginning. I remember it was kind of crazy because I was sitting in a very small waiting room, and the receptionist kind of called out, Peggy Hall, what's your health insurance again? Like, that's kind of crazy that she did so publicly rather than ask me privately. But it did give me the opportunity to very loudly say, oh, I don't have health insurance any longer because I was priced out of the marketplace by the Unaffordable Care Act. So now I do private pay out of my pocket. So I don't like to miss any opportunity to educate people on certain things. And when they knew that I was paying out of pocket and it was a cash price, they were able to charge me what I think is a very reasonable fee, $50 for the x-ray and the doctor's time, and putting me in this walking boot. And they would have probably have had to charge many times more, charge the insurance, so that whatever they were going to be reimbursed at would have been reasonable. Plus, there is the staff that they need in order to do all of that charging and coding of the treatments. And those of you that are in medical coding or in the software that calculates all of that, or maybe you work for Medicare or Medicaid, or you work for a hospital, or you work in billing, you know how complicated that is. So just paying the doctor out of pocket was very simple. It was very inexpensive. I got great care. I did not have to have any operation or anything on my foot, thank goodness. And that was fine. So that gave me a little bit of a pause. And I thought, I probably need some kind of insurance policy. Heaven forbid there's an accident or something else where I need to get medical care. I can pay the $50 out of pocket. But if we're talking about, more complicated procedures or something, that would get quite expensive, and I don't really have that safety net. So that was my situation back in 2014. And that was when we started to look into the Christian healthshare ministries. There are different ones out there. The one that I personally used after looking into others and researching is I chose Samaritan Ministries. And I want to show that to you, not to be confused with Samaritan's Purse. And I have gotten great care and service through this SamaritanMinistries.org. Now, there are different types of programs that exist now that didn't exist when I signed up for the program with my husband. And I want to explain a little bit about how this works and then the procedure that I had. And then I also want to answer a couple of questions that came in one of my cards and letters that my lovely Healthy Americans send to me. And that also has to do with kind of the mainstream medical merry-go-round in general. So we signed up for this, and I'll just tell you that it cost about $400 a month for two of us. And that is money that we actually send via check to another member in this ministry. I know it sounds a little unusual, but that's as simple as it gets. And we include a little note and a prayer letting the person know that we are praying for them for their healing. And we actually find out from this Samaritan ministry. Well, let me back up a little bit. You apply to be a part of this healthshare ministry. It is intended for Christians. So they do want to know if you're attending a church or a fellowship, and there is some paperwork that's required to verify that you actually carry a set of beliefs that are consistent with their principles and values. And there are certain procedures and things that they don't cover. So they do not cover abortions. They do not cover, I think, like psychiatric care. And you can read everything when you go to that website, but there are certain things that they're not going to cover because it conflicts with the principles and the bylaws, I suppose you could call them, of this organization. So you would want to make sure that you align with that and you fill out a questionnaire. And that's one of the ways of getting this membership. Once a year, in my case, it's $400 for the two of us. That $400 actually goes to pay for the administrative cost of this Christian healthshare ministry. And the administrative costs include the interaction with the members. And every month we get a notice from the membership, from the administration, letting us know where we're going to send our money that month and what the condition is that the person is needing medical care for. Now, sometimes it's really exciting, and there's a family that's having a baby, and we, along with others, send a check, an actual check, to that person, not to any health insurance company. And we send along a word of encouragement and prayer and let them know that we are thinking of them and praying for them and that everything will turn out well. So there are some really exciting times like that where there's a birth of a baby. And then there are other things like, broken legs and different treatments and so forth. And those, again, it's so wonderful when I was on the receiving end of the care when I was going through my procedures to restore my vision. So I will give you a little bit of a background on that. This was in about 2018. I had a spontaneous detached retina, completely detached, meaning I was blind in my eye. Now, just to give you a little kind of visual here, the retinal tissue is at the back of your eyeball, and it's very, very thin, much thinner than this little tissue, but it is a type of tissue that can kind of peel away from the back of the eye. And if it peels away a little bit, some people get a dark shadow, in a corner of the eye. And that means that the retinal cells are no longer able to send the image to the brain. I'm giving a very simple explanation. I'm sure there are medical professionals among our healthy Americans here that can go into greater detail, but suffice it to say that this is like a little bit of wallpaper at the back of the eye. And in my case, it completely came down, which meant I had no ability to see out of my left eye. I was completely blind. And it was a medical emergency. And I immediately, strangely enough, one of my students about a week or two prior had a medical emergency with her eye. It was not the same, but she had it's called a posterior vitreous detachment, which I also had in my other eye a year later, where you have a massive amount of floaters and it obscures your vision. So she had been telling me about this specialist that she went to for her vision. So I mean, thank you, Lord, through the grace of God, I actually had the name of a retinal specialist, and I immediately, made an appointment and got in there. And then within a matter of days, I had to undergo a procedure whereby they were going to attach that retina, attach the retina back to the back of the eye. Very, very complex and, difficult and high level. And I completely trusted the surgeon. And that's why I needed to, I guess, go see the doctor to make sure that I was all fine and have the EKG to make sure that I could undergo, probably TMI, I'm telling you all the details, but I wanted to let you know that I had to undergo a hospital procedure and be put under while they were numbing the eyeball and then going in to reattach the retina. It took a very long time to recover. I was like a broken china cup that had been glued back together, very fragile. I could not lift anything over 5 pounds. I couldn't bend over. I had to sleep on my side and be in bed 24/7 for over a week so that the gas bubble that the surgeon had put in the eye to kind of hold that wallpaper in place, so to speak, would stay. And it was a very, very long road to recovery to get my vision back. And, frankly, it's not 100%, but I can see, I can drive. I don't really like to drive at night. You probably wouldn't like me to drive at night, but I do have a driver's license. I know some of you don't, but I do. And I can work and I can live, and I just don't focus. How do you like that little pun? I don't focus on the limitations. I focus on what I can do. So I ended up having a couple of procedures related to this, because then it damages the lens of your eye, and then that has to be replaced. And then I had to have a further laser surgery to clear out the smudges on that lens. And then my other eye had to have the surgery. So anyway, it's been a long, long road. And the reason I'm sharing all of these very personal details with you is because all of those medical procedures were paid for 100% by other members in this healthshare ministry, except there is, in my case, it might be different when you sign up, so I can't say it's the same, but in my case, there is a $300 so-called deductible for each medical condition. Now, even though I had several procedures on my eyes, many, many doctor appointments, many, measurements and things that were very expensive, eye drops and other things that I needed to use to restore my vision. And this was over a period of years. In fact, I'm still seeing a doctor to make sure that I can hang on to the vision that I have and that things are healing and all of that. So over a period of years and tens of thousands of dollars in medical bills, all of that was considered one medical event. So there was only a one-time $300, I would call it, a copay or, deduction. And then from that, 100% was paid by members in this health share. They sent me cards and letters letting me know that they were praying for my restored vision, sending me Bible verses. And I'm telling you, not only did the money help because it paid the bills, but the prayer and knowing that there were people that cared about me and my recovery. And again, it is such a blessing to receive that and to know that none of these giant, Blue Cross and I don't have anything against these insurance companies, except for Kaiser. Personally, I'm not here to denigrate any of them, but this is what works for me. And there is a little bit of a caveat, and there are different programs that will suit different needs. when I was dealing with the doctor and the surgeon and all of everything that I needed to do, from blood work to the EKG to everything, I let them know that I was a cash paying patient, that I didn't have health insurance, and that I wanted to know if there was any cash discount. And I would say 9 out of 10 times there was a cash price that was more reasonable than the insurance price, for the reasons that I mentioned earlier in this video. So that also helps with the healthshare ministry, that the costs overall are lower because there is no insurance company in the middle as a middleman. Once a year, that $400 goes to the administration, and every month after, my husband and I send this money directly to someone in need for their medical bills. Now, in my case, the doctors were willing to have like the payment plan, because it did take about 3 months for the money to start coming in. You have to submit the documents and then they're approved. So I don't want to give you a real life picture of what this is like, but I have never had anything denied, and everything has been paid for in full. And it usually takes about 3 months. So, letting the doctors know that you're with a health share ministry and that there will be a little bit of a delay in payment, I haven't had a problem with that. The other great thing about this is that I can go to any doctor I want. I was able to go to the very top specialists in Orange County when it comes to the retinal care. I didn't have to get any approval. I didn't have to, go up the chain of command in these health insurance companies and have a general provider and then go to a specialist and be referred. I mean, this was immediate. And I have never had any issue with the reimbursement from the healthshare ministry. And again, I've been to the top surgeons in the region. So I was able to do so quickly. There was no delay. I didn't have to have any approvals. It was all done, and I was reimbursed 100%. Now, there may be a situation, just to give you the full picture, whereby you may have a doctor that says you have to pay for this right when you arrive or right when you leave. We don't have a payment plan, and you pay when services are rendered. It doesn't matter that you're a cash pay or that you're in the Christian health share ministry. We don't operate that way. That may happen. So there are a couple of options where maybe you would find a different provider who would be willing to have the payment plan. Or if you're in a position where you do have, since you're not paying the thousands of dollars a month to the insurance companies, you could set aside, there are some health savings accounts. You'd want to check with your financial advisor about that. But there are ways that you can set aside money without paying taxes on it. My understanding, again, don't quote me, but there are ways that you can set aside money for your medical expenses. And so that would be one thing that you could do. Instead of sending money to an insurance company every month, you put it in your own little stash, knowing that you can use that in case of an emergency, where if the doctor wouldn't go on a payment plan. Also, my understanding now is that the Christian Samaritan Ministries that I directed you to, and I'll have a link for you in the description box below, that you could opt for a program where they do pay in advance and that you don't have to worry about paying out of pocket or having a payment plan. So if that's something that would put your mind at ease, it most likely is more affordable than the health insurance. But I'm not even frankly doing this just due to the amazing savings that we have financially. But for me, I don't want to participate in these, giant, big medical merry-go-round health insurers. I don't want to be a part of that. And I've had nothing but excellent service in the Samaritan Ministries. Let me share this with you one more time. And then I do want to finish off with a couple of your cards and letters. So this is it, SamaritanMinistries.org. And I hope that this will be a blessing to you, as it has been for me. There are a couple of other large ones out there. I did not find that they were a good fit for me. So that's why I chose this one. Now, there was a letter that came from a Healthy American. I'm going to keep this confidential. And she had a couple of questions. And I think some of you may have these questions as well. And I want to thank everybody who sends me cards and letters. There is the address in the description box below. If you're listening to this and you don't have access, that's simply Peggy Hall, 205 Avenida del Mar, number 681. It's a P.O. box, and that is in San Clemente, California, 92674. I do endeavor to send thank you notes to those of you that send me a card or letter, and those financial supporters are invited to our monthly private live webinar where we answer your questions. We really go off script and we are speaking in an uncensored manner. So I hope you will join me. Let me share with you this letter. She says, "Dear Peggy, first, thank you for being a normal, healthy, critically thoughtful person who is willing to be brave enough to stand in tyranny's way. You're also a riot," she says. "I laugh out loud every time I watch you. I adore your sense of humor and we communicate in a very similar way. Thank you for that." She said, "I'm a sister in Christ and gratefully, blissfully aware of the non-spinning earth." That's just a little aside. I know you guys don't always like that. By the way, just as another aside, I don't know how you conclude that I am a flat earther just because I talk about no physical evidence for the earth spinning, right? The Bible says it's a dome and I just go by God's word. So I don't know how you conflate those two, but that's jumping to conclusions. All right. She says, "I'm very skeptical about all current events and goings on." And then she said, "I have two questions for you and maybe you can do a video on them. So here we go." She said, "I have some loved ones who are almost fully awake. And she does want to know about the non-spinning earth, as I call it." She said, I'm anxious to approach them. And how do you typically approach that subject with someone? Have you ever red-pilled someone with that information? I'd love to have some scriptures to point to, and I'm beginning to make a list of my own. So first of all, I don't have that conversation with anyone unless they are specifically asking me about it. I don't want to impose my point of view on somebody who's not interested in hearing it. I do have a video called "How to Deal with Difficult People." I'm not saying that your friends or family members that you want to have these discussions with are difficult people, but in that video, which is a longer video, it's about 45 minutes. It's one of my favorite videos because I go into great detail with specific expressions on how to open the door to having conversations. And just a quick summary, normally it would be something along the lines of, "Oh, I have a different point of view. Would you like to hear it?" And then you wait for them to say yes or no. And if they say no, at least they're being honest. And then you know not to broach the subject. And if they say yes, well, they've opened the door to the conversation. So ideally, they're going to be more receptive. I have another video called "How to Have the Hard Conversations." And a summary of that is to put a time limit on when you're having difficult discussions so that emotions don't spiral out of control and you don't get tired and emotional. And then I also recommend having these hard conversations in a neutral area. So this is not where you're sitting across a desk from someone, or they're at your house or you're at their house and there's a little bit of a power dynamic there. Like, go out for a walk and it's neutral ground. You're moving. There's less anxiety and all of that because you've got, you're breathing and you're moving physically. So I recommend having these conversations in a neutral ground with a limited period of time and really pose questions more than impose your point of view. Sounds kind of funny, I know, because my whole channel is about sharing with you my point of view, but I figure that's why you're here, because you'd like to hear what I have to say. So the second question is, she says, "I'm aware that you're with Samaritan Ministries, and my husband and I are still on regular health care for logistical reasons." And she said, "But we are looking forward to unsubscribing from that someday. And we've recently taken to unsubscribing from most of the preventative measures. They always want to test you for things." And she said that she doesn't do these, let's just say, routine screenings any longer. And remember, you should do exactly what the CDC says and the WHO and your doctor. So don't question anything because they're always right. I just want to make sure that's on the table. She says that she doesn't do the routine screenings anymore. And her husband doesn't do the typical male screening things either. And they occasionally do blood work to check on things to see if there's anything out of balance. And she's saying, "I think you're probably of a similar mindset. As Christians, we don't fear death, but as a healthy and sound person, breathing oxygen, she wants to know if I do any preventative care." So that was actually the question. She does do eye exams and dental care, but they thoroughly research procedures before participating. And adding on to that question, she wants to know if I'm ever skeptical about these various diagnoses. And she said, wouldn't it be crazy if there's a person who feels fine, goes to the doctor, gets a diagnosis, and then gets all of the procedures, and then is worse off than they started? Oh, and of course, that never happens. So that's just hypothetical. Yeah. I'm so grateful that you wrote, and I love to hear from all of my healthy Americans. And I want to answer the question about the preventative screenings and all of that. Frankly, I don't participate in any of it. I have my lovely Dr. Charie, who is a colleague and a healthy American. And I've had her on this channel many times with videos. In fact, I did one right before Thanksgiving about getting your digestive system in order and, detoxing naturally. And I will have had previous videos with her, and I will continue to have videos with her. And my husband, Pastor David, went to Dr. Charie just because he was feeling a little low energy, and he wanted to get some tips just related to lifestyle. And maybe supplements, or if there was something that was lacking. And she had very good advice about listening to your body when it comes to your lifestyle. If you eat something and then you have a deleterious effect, you can put the two and two together and say that food did not agree with me. You don't have to go through very expensive, well, I don't know if it's expensive, but you don't have to go through the, food allergy testing if you don't want to or unable to. And I know some of you probably love all of that, which is great, but she has a very simple approach. And I hope that you'll watch some of those videos, and that will give you a lot of information about how important it is to get your sleep dialed in, to get your stress dialed down, to live a life that you love and enjoy, and you're participating in and sharing your gifts and being involved in ways that make your heart and soul sing. So she is much more of a holistic practitioner, and you can learn a lot by watching those videos. So that's one thing that I would recommend, and you can probably glean something along the lines of what she recommends with these preventative screenings. And I'm pretty sure that, well, what I can say on this channel and I can't. So I hope that you will watch those videos. And for myself, I do get my eye. She asked what kind of preventative things I do. I do go for a dental cleaning once in a while, although I pretty much just take care of my teeth sort of on my own. I do like to do a little bit of baking soda and coconut oil, and I brush with that, and I find that that keeps the teeth healthy. Yes, these are my teeth. And there you have it when it comes to the teeth. When it comes to my physical health, I do have the routine exam for my eye because of that detached retina. And that has been very important for me, for the doctor to see if there's anything that's going on there. Luckily, and by the grace of God, things are healing well and holding steady. And I want to maintain the vision that I have, and I want to maintain my own health. So my husband and I are very, very holistically, naturally inclined when it comes to our health. Just to share, we're not on any medications. We don't smoke or drink, or, maybe there's a glass of champagne to toast a birthday or an anniversary or something like that. But we strive to live a healthy life by taking care of our sleep, by dialing down the stress, by doing things that we enjoy, really focusing on enjoying God's beauty. We really look at the donut instead of the whole. I don't know if that's a good metaphor to use, speaking about, healthy living and all of that, but we focus on what is going right in life. We really spend time in gratitude and prayer for all of the blessings that God has given us and all of the blessings yet to come. No one is promised a tomorrow. And my heart aches for those that are suffering physically, mentally, emotionally, spiritually in life. I've done many videos, not only on this channel, but on my other channel called Living Swell with Peggy Hall. And if you would take a moment to just resubscribe to this channel and hop on over there and subscribe in case this Healthy American channel ever goes down, ideally, Living Swell will still be the backup channel. I've noticed, and you've told me, that YouTube is unsubscribing you from my videos. There's also a lot of funny business going on with view count. When I look behind the scenes in my dashboard on YouTube, I can see the view count of, for example, let's say 5,000 views on a video. But then when I go to the actual video on YouTube, it's showing like, 250. It's like, that is weird. What's going on with the algorithm? So lots of strange things. So just a little plug, if you would please resubscribe, hit that notification bell, and let's outwit this algorithm that is really strangling the messages that I want to send, that I want to share. And the messages that I want to share really are based on feeling grateful for every day, which is a gift of life, even in the midst of the hogwash and the oppression, not only even in, but because of what we've been faced with. It makes me want to live each day even more fully and more full of gratitude, and spend time doing things that I love and balancing being informed and not crossing over that line to being obsessed. And also observing current events and horrific events that are going on while still guarding your heart. The Bible does say to guard your heart, to take every thought captive, and to not let your emotions run away with you. So I've got videos on this channel about observe, don't absorb, and different ways of coping when you're witnessing tragedy. So I hope this is helpful. This ran a little long, and that's okay. I'm so grateful to have you all on board. A big shout out to the moderators who keep that stream flowing, and a big thank you to all of you, my lovely Healthy American subscribers. I have the best audience on YouTube. You are sophisticated, you are supportive, you're a little snarky from time to time, just like I like it, because we need to keep a little bit of levity in some of this heavy stuff that we are faced with. So there you have it, friends. That's the deep dive on why I don't have health insurance and what your doctor might be hiding from you. And for heaven's sake, make sure that you can get a hold of your medical files and do a deep dive to make sure that they are not charging your insurance for procedures or conditions that you don't have, or that they are labeling you with these conditions that you have never mentioned. I really don't care for labels of any sort. And you really can get pigeonholed in these ways, in the medical community as well. So thanks again for being on board, friends. I will have a video for you tomorrow, which is Friday. I like to be a little bit more lighthearted as we close out the week. So I've got something for you related to Band-Aids. And if you have no idea what I'm talking about, I need to have a playlist all about Band-Aids. It's very strange, and I want to get to the bottom of this, and I can with your help. All right. See you soon, everybody.